autism and methylcobalamin, or what we usually call MB12 injection. So the question is, can MB12 improve speech and brain development? Hello everyone, I'm Dr. Lee Kok Wah. So today we are going to discuss a topic that many parents of children with autism ask about, MB12 injection. So can MB12 injection improve speech, social interactions, attentions, and behavior in children with autism? Is it a proven treatment, or is just another autism myth? Okay, first of all, we should understand what is methyl B12. So methyl B12 or MB12, also known as methylcobalamin, it is an active form of vitamin B12 which play an important role in brain development and functions. Beside that, nerve systems or nerve functions, energy productions, detoxification pathway, production of neurotransmitter, and etc. Unlike regular vitamin B12 supplement, MB12 is ready in an active form that can be ready used in the body. So why is MB12 being used in autism? Research has shown that some children with autism may have abnormalities in methylation pathway, glutathione productions, oxidation stress regulations, and remember that parents, glutathione is one of the body's most important antioxidants that helps to protect the brain cell from damage, whether it's from oxidation stress, heavy metal, or inflammation. So some researchers believe that improving methylations and glutathione level may support brain functions and neurodevelopment in certain children with autism. So now the next question is, let's look at the research. What does the research show? Several small studies has suggested that MB12 injection may help to improve speech and language development, social engagement, eye contact, attention and focus, and awareness of surrounding overall adaptive function. However, parents, it is important to understand that the results are variable. Okay, some children may show significant improvement, some may show mild improvement, and some may not show any improvement at all. Okay, at present, MB12 injection are considered a complementary or adjunctive treatment rather than a cure for autism. Okay, so how do we know which group of children may respond better? So clinical observations suggest that children who have speech development delay, developmental regressions, okay? So methylation abnormality, gastrointestinal issue, or there's a sign or symptom of oxidation stress may be more likely to benefit, especially those children with gastrointestinal issue. Okay, so unfortunately, there's no perfect test that can predict who will respond and who will not respond. Okay, so how are we going to give this MB12 injection? So it is commonly administered as a subcutaneous injection, so usually every few days depending on the treatment protocol. The dosage and frequency vary from practitioner and also the symptom presentation of the children. Okay, so yes, patients should only administer MB12 under medical supervision and according to professional guidance. Okay, so another common question, are there any side effects? All right, so MB12 is generally considered very safe. Possible side effects include hyperactivity, increase in energy, which can cause sleep disturbance, irritability, emotional sensitivity. So at the site of injection, it can cause this discomfort, pain, or at times allergic skin allergic reactions. All right. So my clinical experience, okay, in my practice, I've seen some children demonstrate improvement in speech, attention, awareness, and social engagement after MB12 therapy, usually 3 months, 6 months. Okay, so however, the response vary greatly from a child to another child. Right, so therefore, it is important for us to set a very realistic expectation and monitor the progress objectively. Okay, how are we going to monitor? Every 3 months, we assess again. Every 3 months, we can assess again. If there is no significant improvement after 3 months to 6 months, then we should safely stop the MB12 injection and your child may not respond to MB12. So conclusion, parents. So MB12 injection are one of the several biomedical interventions being explored in autism. Okay, current evidence suggests that potential benefit for some children, particularly in supporting the methylation pathway and reducing oxidation stress. Yes, it seems promising, but MB12 should not be viewed as a standalone treatment or a cure for autism. Remember that it's not a cure for autism. A holistic and individualized approach remains the key to helping every child to reach their fullest potential. All right. So if you found this video helpful, please like, share, and subscribe to our channel. I see you again in the next topic. Bye.